Kia ora everyone, this is almost everything you'll need to know about the bones of the head, and that generally means the skull. The skull is a combination of many bones that are joined together by these sutures, which are fibrous type joints that are only found in the skull. The skull bones are divided into two groups, those that contain the brain, which is the neurocranium or brain box if you like, then the bones that are related to the face, or that the face kind of hangs off, which is the Viscero cranium. The mandible is a separate bone joined to the skull bones at the synovial temporomandibular joint here, but it's generally discussed with the skull bones, and that's what we'll do. You probably already know the names of the bones of the skull, but just in case, this is the parietal bone, this is the temporal bone, this is the frontal bone, and this is the occipital bone. This bone here, which we can only see part of, is the key bone in the skull. It connects essentially the neurocranium to the viscerocranium through the orbit, and it is the sphenoid bone. And we'll be seeing a lot of the sphenoid bone. So those are the bones of the neurocranium. To look at the bones of the viscerocranium, we'll switch to a frontal view, and we can still see obviously the frontal bone here, the parietal and temporal bone that we can see here. This is the zygomatic bone, sort of the cheekbone, and this complex bone at the front is the maxilla, which consists of two bones fused together, two maxillary bones fused together. And we can also see the small nasal bones here. Apart from the nasal bones, these aforementioned bones also contribute to the walls of the orbit. The frontal bone contributes to the roof of the orbit, the zygomatic bone to the lateral wall of the orbit, and the maxillary bone to the inferior part of the orbit or the orbital floor. The posterior part of the orbit, it's cone-shaped in section, so towards the apex of the orbit is the sphenoid bone. That's both these areas here, but they're separated by this large fissure, which is the superior orbital fissure. And the superior orbital fissure separates the greater wing of the sphenoid bone from the lesser wing. So greater wing here, lesser wing here. And the superior orbital fissure is a window between the orbit, representing the visceroskeleton, and the cranial cavity. So many structures that travel from the neurocranium or cranial cavity to the orbit and to other parts of the upper face do so through the superior orbital fissure. We'll colour things up to try and make that a little clearer so we can see the different bones more clearly now, and we'll zoom in on the orbit, and on the right here, this is the lesser wing of the orbital part of the sphenoid bone, and this is the greater wing. And the superior orbital fissure looks orange here because we're actually looking through the empty neurocranium at the inner table of the occipital bone. You can also see here a little better the bones of the medial wall of the orbit. This reddish one more posteriorly is the ethmoid bone, and this purple one is the lacrimal bone. We'll look at those from a different view shortly, but it's worth noting that the ethmoid bone, the reddish one, also projects into the nasal cavity. It's this darker red bone here. It forms part of the midline bony septum here, and also these are the middle nasal conchae. And between the two orbital parts of the ethmoid bones lies the ethmoid sinuses, which fill in this part of the skull behind the nasal bones, and in fact project up towards the neurocranium, and the ethmoid bone is represented in the neurocranium by the crista galli and the cribriform plate, which we'll see when we look into the neurocranium. We'll look at that more lateral view now to see the medial orbital wall. So here is the ethmoid bone forming most of the medial orbital wall, and the lacrimal bone, the anterior part. The ethmoid bone here is very thin. It's known as the lamina papyracea or paper wall, and in blunt trauma to the orbit it can be easily fractured, and fractures through there communicate with the ethmoid sinuses, and so that can allow air from the sinuses into the orbit, especially if it's put under pressure, such as when a patient blows their nose. Air in the form of surgical emphysema can enter the soft tissues of the orbit, which can be moderately spectacular. You might be able to appreciate a recess just below the lacrimal bone here, and that is for the lacrimal sac, which is the part of the lacrimal apparatus where tears are collected and then drain into the nasal cavity via the nasolacrimal duct. The actual lacrimal glands are in the upper outer part of each orbit, so that's where tears are formed, and they wash down across the eye and are collected medially by the lacrimal apparatus and drain into the lacrimal sac and thence into the nasal cavity. And we can also see here another feature of the lesser wing of the sphenoid bone, which is the optic foramen. So this hole, which we can just see here, is the passageway for the optic nerve and the ophthalmic artery from the cranial cavity into the orbit. And we can also see here some of the different parts of the temporal bone. This flat part is the squamous part of the temporal bone, squamous meaning flat. Most of the remainder is rocky or stone-like, and that's the petrous part of the temporal bone. Petrous means like a rock or stone, hence we have words like petrify, which means to turn to stone, and petroleum, which is the oil that comes from rock. Structures related to the petrous part of the temporal bone are called petrosal, and they're not very important structures, but you may come across them, and that's the reason why they have that name. Other features of the temporal bone are the external acoustic meatus here, which is the external opening of the auditory canal, the zygomatic process of the temporal bone, which joins with the temporal process of the zygomatic bone to form the zygomatic arch, and also the condylar fossa, which is the fossa for the condyle of the mandible, which forms the temporal part of the temporomandibular joint. Considering the mandible, it is the jawbone, and it's made up of two parts. This lower part is the body, and this other part is the ramus, and they meet at the angle of the mandible, or angle of the jaw. The body is the part that bears the alveolar process, which carries the sockets for the mandibular or lower teeth. The ramus has two processes: a condylar process, which carries the mandibular condyle, which is the articular surface for the mandibular part of the temporomandibular joint, and the coronoid process, which is a pointy process. Coronoid means pointy like the shape of a crow's beak. Coracoid means pointy like the shape of a raven's beak, which are slightly different, apparently, an important ornithological distinction. Anyway, the coronoid process of the mandible is for the attachment of the temporalis muscle, which fills the temporal fossa and attaches to the coronoid process behind the zygomatic arch here, and acts to close the jaw, one of the four muscles of mastication. In between the two processes, coronoid and condylar, is the mandibular notch, and another feature of the body of the mandible is the mental foramen here, which is the exit point for the end of the inferior alveolar nerve, which is the cutaneous mental nerve, which supplies the skin overlying the mandible. The mental foramen is roughly in line with two other foramina, the infraorbital foramen of the maxilla and the supraorbital notch mostly, which is about here in the frontal bone, and these form a rough line through which the cutaneous branches of the trigeminal nerve all protrude or project. So the mental nerve, the cutaneous part of the mandibular division, or V3 of the trigeminal nerve, V meaning 5, is in 5th cranial nerve. The cutaneous part of the maxillary division, or V2, is the infraorbital nerve, and the cutaneous part of the ophthalmic division of the trigeminal nerve, or V1, is the supraorbital nerve. And of course these foramina which emit the nerves are where a Vulcan places his or her fingertips to initiate a Vulcan mind meld, as shown here by the mirror. Mr. Spock mind melding with the not so cooperative Dr. McCoy from the original series, here from the movie reboot Spock Prime mind melding with the Chris Pine version of James T. Kirk, and here from Star Trek Voyager, Tuvok, another Vulcan, mind melding with B'Elanna Torres. His upper fingertip is slid a bit laterally there to account for B'Elanna's cranial ridges, because obviously she's half Klingon. Returning to a purely lateral view, we can perhaps get a better idea of the lacrimal fossa in this view, and also these features of the petrous part of the temporal bone, the very bold mastoid process here, and this very pointy process also of the temporal bone, which is the styloid process. And between the mastoid and styloid processes on the undersurface or cranial base is the stylomastoid foramen, which is the main exit point for the motor branches of the facial nerve, the seventh cranial nerve. In this view, we get a good look at this area here, which is where the frontal, parietal, temporal, and sphenoid bones meet, and this junction is called the Terion. It's one of the many craniometric points which serve as landmarks for measuring various parts of the skull, which is useful in radiology and in anthropology. Other craniometric points include the vertex, which is the most superior point in the skull, the inion, which is the most posterior point, and the point where other sutures meet, so where the sagittal suture between the two parietal bones meets the coronal suture here is the bregma, and where the sagittal suture meets the lambdoid suture, which is this one of the occipital bone, is the lambda. Craniometry, of course, not to be confused with phrenology, which was the pseudoscience of attempting to ascribe or predict mental and personality traits based on measuring various external bumps on the skull. That was expounded in its most vile form by the monstrous character Calvin Candy in the movie Django Unchained, played, of course, by, gratuitous excuse for a picture of, Leonardo DiCaprio. So finally, we'll turn to a view of the inferior skull or skull base. We can see the major part of the occipital bone here, and it features this large hole, which is the foramen magnum, which is either Latin or Greek for big hole. Either side of the foramen magnum are the articular processes for the atlanto-occipital joint, the joint between the occipital bone and the first cervical vertebra, the atlas. And these are the occipital condyles. We can see on the temporal bone, this is the mastoid process projecting towards us, and this is the styloid process. And in between them, we can see now the stylomastoid foramen, again the exit point for the motor branches of the facial nerve. This is the external acoustic meatus, and here is the condylar fossa with the condyle of the mandible within it. This other large foramen in the petrous part of the temporal bone is the Carotid Canal, which is the entrance to the skull for the internal carotid artery, and it takes a tortuous route through the petrous part of the temporal bone before emerging in the middle cranial fossa. We can see also here the very complicated architecture of the sphenoid bone, which is joined to the occipital bone here. The greater wings are these parts that are extending out laterally again. The lesser wings are away from us, more superiorly. And these plates that are projecting down vertically towards us, here and here, and on the other side here, are the pterygoid plates. Pterygoid means wing-like. And these are the attachment sites for the pterygoid muscles, which are two of the other muscles of mastication, one to the medial pterygoid plate and one to the lateral pterygoid plate. So, as well as having greater and lesser wings, the sphenoid also has wing-like pterygoid plates. And really, finally, this time, if we zoom in, you may be able to appreciate that here is a little spike which protrudes out towards us, which is the spine of the sphenoid bone, and this foramen adjacent to it is the Foramen Spinosum. It transmits the middle meningeal artery, and this larger foramen next to the Foramen Spinosum is the Foramen Ovale, which transmits in the opposite direction the third division, the mandibular division of the trigeminal nerve, which escapes the cranial vault and projects down, which would be towards us, towards the mandible here. Then enters the mandibular foramen and travels through the bone to innervate the mandibular teeth and then emerge through the mental foramen, as we saw earlier. We'll quickly note the Palatine process here of the maxilla, or maxillae, and they are joined to the Palatine bone, which is this violet creature here. This plough-like bone, the yellow one, is the voma, which is Latin or Greek for plough, and we're also seeing here the projections of the ethmoid bone, the nasal conchae in the nasopharynx. That's almost everything you need to know about the external skull, well and truly. We'll look at the internal skull in the next video. Until then, study hard from your books and ka kite.